Hi, I am Dr Suvadip Chakrabarti, consultant surgical oncologist at Apollo Clinical Cancer Institute, Kolkata. Today we will be throwing some light on the common causes of breast cancer and some signs and symptoms so that people become aware. Contrary to the global trend where the breast cancer is seen more in the 5th or the 7th decade of life, we have an alarming stage, we have a trend which is showing that in the late 20s and in the early 30s, the new breast cancer patients are being diagnosed. Now, what does it imply? It implies one, our breast cancers are different from the world. Second, they are more aggressive, they have a propensity to spread more, and that's why high morbidity and poor outcomes. Now, why we have a poor outcome? If you see of all the patients that are coming to our OPD, almost close to 75% are at an advanced stage. By advanced stage, I mean it is stage 3 or 4, where multimodality treatment is there. Now, in breast cancer, if we see the survival rates, if we see from stage 1 to stage 2, it is from 90 to 95%. Again, it drops alarmingly when it becomes in 3rd or 4th stage, which in some studies show 40%, some studies show 60%. So the main thing is awareness. Most commonly is our people are not aware of the signs and symptoms of breast cancer. The most commonly is a lump in breast, which I've seen accidentally, most commonly. Other will be spontaneous nipple retraction, scaliness of the skin, redness of the skin. There may be distortion on the nipple areola complex. There may be lumps forming in the breast or some in the axilla. Majority are painless. If arise with pain, it is a sign of advancement. Another thing that is most commonly that we see that people are coming out is whether breast cancer is familial. Now, even in some parts of Bengal, in the rural parts, we have seen that once a family is diagnosed or a woman is diagnosed with breast cancer, the social ostracism takes place where the family shun. So, if we go by statistics from the Western data and the Indian data combined, hardly 5 to 10% have a familial, means a genetic predisposition. So my thing is that if a family member is affected by breast cancer, there is need for more surveillance. It doesn't mean that the daughter will have cancer, but the surveillance has to be taking place. For example, if the mother is diagnosed with a breast cancer at the age of 50, the surveillance for that female should start at the age of 40. Now, apart from this, if we see what are the causes of breast cancer, majority are our non-heritable, which can be modified. For example, diet. Lot of fatty food. We have a lot of adipose tissue which gets converted into estrogen, which again affects and develops in breast cancer. Then long menstrual period with like early menarche or late menopause. It has a prolonged effect of exposure to estrogen and estrogen. Now, nulliparity, not breastfeeding. See, while we do breastfeeding, the body releases prolactin, which is protective. Again, the estrogen effect that is there, which is masked, which is stopped by that. So nulliparity is also a case. Now with the advancement of ages of females are all going for higher studies, higher education, the age of the first child, again, why do we say that? Because the first child means that it will break in your estrogen exposure. So the prolonged period after which your child is, for example, at the late 30s, your chances of breast cancer becomes more. Apart from this, if we see familial, as I told you, it's 5 to 10%. Now about modalities of treatment. Modality is earlier it was cancer means a death sentence. Now with the advancement of technology and advancement of research molecule and everything, we have very new options like breast conserving surgery, where the tumor with a microscopic negative tissue is removed. The axilla is deeper. We have sentinel lymph node biopsy where the axilla is not has not to be done. Mammography is a mode of surveillance which is ideally done after 40 or before that USG. Now with recent advances like studies like breast thermography, which are totally non-invasive, we can identify tumors even in the young population. So basically, with all these things, I would say this October, let us all rise about breast cancer.